Rethinking Healthcare. Almost everyone agrees that healthcare in America is on a downward spiral. Healthcare costs too much for many people who do get it. The premiums most of us pay take a big chunk out of our budget, and that chunk is growing much faster than the rate of inflation. Unpaid healthcare costs are the most common cause of personal bankruptcy. Healthcare costs so much that some people don't get it. More than 40 million Americans are uninsured, and many of them suffer unnecessarily because of that. And sometimes healthcare kills the people who get it. The AMA estimates that 100,000 people die every year from prescription drugs, and many more die from preventable medical accidents. Some of our treatments for cancer remind one of the medical experiments performed in Nazi death camps. We can't go on this way. We are spending huge amounts of money on extreme care for a relatively small number of very sick people, while many people are denied basic care. I offer a new principle. No one gets extreme care until everyone gets basic care. We also know that we are spending twice as much per capita than other rich countries, and many of them get better outcomes in terms of infant mortality and life expectancy. Rather than annual increases in premiums, the healthcare industry should be giving us annual reductions until our costs are more in line with the costs in other rich nations. The truth is that for lack of strong regulation, some parts of the healthcare industry have fallen into the habit of ripping us off because they can. We also need to consider the possibility that some of the medicines we are taking are actually bad medicine. It is a fact that diabetes is one of the most common causes of death in the U.S., and many diabetics suffer greatly before they die. It is also a fact that a very common medication increases the symptoms of diabetes and may even cause it. This is insanity. One area where we need to rethink is toxicity. We know that we are constantly taking in thousands of man-made chemicals other than medications through our food, our water, our lungs, and our skin. To give one example, there are any number of chemicals that mimic the effect of estrogen on the human body. Early sexual maturation of girls may be just one side effect of this exposure. For decades, we have believed that if large doses of any given chemical did not kill rats, then small doses were safe for humans. While that may be true for any one chemical, it is probably not true when we are exposed to thousands of chemicals on a daily basis. We need to consider that at the cellular level, we respond to very minute electrochemical signals. Our exposure to thousands of chemicals, as well as an atmosphere filled with electromagnetic radiation, may be one reason why our cancer rate is so high. We need to go even deeper and think about our DNA and the epigenetic control of DNA. The DNA in each cell is a blueprint for making another healthy cell, but that blueprint won't work unless the proper raw materials are fed to it. Beyond that, the activity of DNA is controlled by 4 major classes of chemicals, and this is another opportunity for cells to run amok. Proper functioning of DNA boils down to nutrition, what we take in. If we take in something that is not a protein, a carbohydrate, a fat, a mineral, or a vitamin, then that input is basically a poison. We need to stop taking in so many poisons and use up-to-date knowledge to ensure that we are taking in the proper nutrients. Bad food is a primary cause of degenerative disease, and good food will be good medicine for many ailments. Beyond that, we need to recognize the spiritual element in health and disease. I am not talking about organized religion of any particular brand, but rather about the realities that exist above the vibrational level of physical matter. Everything from Tai Chi to psychotherapy can help at this level. All of this is a radical departure from current practice, but nothing less will do the job.